Now welcome up our first presenter, and that is Dr. Todd Binkley. All right, he's with the Binkley Healing Center. He's out of Ventura, California, 32 years plus in the business. He has a pet that says one 17-year-old cat named Sophie. He's into reading, writing, woodworking, researching medical mysteries. He also lives in Ventura for 31 years. Previous types of jobs, what do you think he did before? He's a college student. He's been doing this all his life. His burning desire is to educate, inspire, and equip a few thousand more people to seek and maintain vibrant health. At age 10, he caught the final out in the final inning of the final game in a Little League baseball tournament, and they won first place. Thank you, Dr. Todd. And his key to success is listen attentively and communicate effectively. You're welcome, Dr. Todd Binkley.
Thank you, Ray. So one of the most common questions I get is, what is functional medicine? Well, ordering a lot more tests than most doctors order is what allows me to identify conditions that other doctors miss. So a lot of people think, oh, I get my annual physical every year. I see a doctor, I'm keeping on top of things. But they use these broad ranges like this to determine whether or not you need medical care today. They're not checking to see if you're healthy. They're checking to see if you need a prescription or a referral to a specialist or a CAT scan or an MRI. So, oops. So it's really easy to diagnose diabetes, as I was saying before, infection with most of the things that you see. And when you do more tests and a more comprehensive evaluation of those tests, it makes possible something that is beyond the reach of any drug: the restoration of normal human physiology, of normal function, which is also known as health. So how healthy are you? Do you know? Who thinks they know they're healthy, perfectly healthy? Yeah. Well, if you feel fine, that means you're healthy, right? Well, this guy feels fine. He has no symptoms at all, and he didn't have any right before that, because he was taking his cholesterol medication and his diabetes medication and his blood pressure medication. So therefore, all those conditions are gone, right? As long as you're taking the meds, you're good. Well, 3,000 people die every day on that program in this country alone. Cardiovascular disease is still the #1 cause of death. And even though all these people are taking the meds for it, they still die of that condition earlier than they should. So you have no idea how healthy you are unless you get proper testing. So how healthy is your husband or your daughter or your neighbor or your best friend? They have no idea how healthy they are either, unless they get comprehensive testing. So without proper testing, you're basically watching and waiting until you need to go to urgent care or the hospital. But comprehensive testing can identify earlier signs of stress on all of your organs and systems early enough that you can usually fix it with better food, with a little more exercise, with some research-based supplements. Well, why is that? Well, again, cardiovascular disease, #1 cause of death. It builds very slowly. Blockages in the arteries accumulate over years, and you don't feel a thing. You don't feel a thing in a blocked artery until it's 100% blocked and you have a heart attack or a stroke. The first symptom of severe underlying heart disease is sudden death. Happens a lot. So how many people are thinking right now, oh, I don't want to know. I don't want to get tested. I don't want to know. I hear that a lot too. Why wouldn't you want to know? Well, I think one of the reasons is you think you might have to change something that you don't want to change. Or worse, you might think that you're going to end up disabled. Or worst of all, you might think you're going to die. Well, you're not going to die. And it's on average, just anybody who's considering doing testing like this, very unlikely that you're going to be disabled. And lots of times, you don't even have to change something that you don't want to change. You might just have to do a couple of things a little bit different. So here's an example. This is a typical panel that you get when you go for your annual physical. Just a few tests to identify whether or not you have kidney disease or diabetes, liver disease, one test for thyroid to see if your thyroid needs some attention. And so people think when they do that, oh, my doctor checked everything. No, they didn't. They checked a few things to see if you had a severe condition that warrants treatment right now. And there's nothing wrong with that. It's just a lot of people fall through the cracks when that's the only kind of testing they get. So here's an example of what happens when you do a more comprehensive workup. This is a patient of mine that was coming for something else initially, and she said, I want to do that test that you're always talking about. I feel fine, I just want to get checked. Well, I always make somebody fill out a 7-page questionnaire, and I ask them more questions. And after on questioning, she admitted that she had brain fog and high blood pressure. She wasn't taking medication for it, but it was running a little high. She has anxiety, weak circulation, lack of stamina, heart was skipping beats, and she was also concerned about a few other things. So when I did the tests, we found out that she has massive iron overload. So I'm not sure if you can see that, but ferritin is the test, one of the tests that most doctors never do, and that's the test that's essential to determine iron overload or severe iron deficiency. It's 3,280 something. The upper limit of normal is 150. This is over 20 times the upper limit of normal. I had to refer her to a hematologist. She has to do a whole bunch of blood donations over several months to get that back down to normal. It takes decades for that to accumulate. She'd been going to her physician for the annual physical every year for decades, and they never did that test, so she never knew she had that. And what iron overload stresses your liver. She already has signs of significant impairment of her liver from the inflammation that causes. That's what these blue tests. The things that are in red are the things that any doctor would identify as a problem on your normal test that are outside this broad clinical range. The things that are in yellow are inside this narrower range, roughly the middle third of the standard medical range, which represents normal human health. This is what your blood tests look like, this range, when you're in your teens and your 20s and everything's working perfectly. So we look at those yellow things as well. Those always get ignored. They're not considered medical practice and not considered medically necessary. But you can identify things places where your body needs support. And when you address everything at once, think of your body, think of your bloodstream as a river of life. You've got construction crews on both banks of the river, and they're waiting there to do various projects that are on hold. And if the materials are there, then that job gets done. If the materials aren't there, then that just gets put on hold indefinitely. And when people feel that, they say, it feels like I'm getting old. Well, it feels like your body needs the support to stay younger and healthy right now. So she was also having some damage to the kidneys. That's what these tests show, and to her immune system. And I gave her, she sent her off to that hematologist, and she's doing a lot better now. So you never know what you're going to find until you get tested. This is a 46-year-old man, otherwise healthy, looked great. He came in for heartburn. His wife sent him in, and I found out he has leukemia. That's what all these blues, way, way out of the range. Almost every type of white blood cell is off the charts. And that's not uncommon. Leukemia is usually identified on routine blood work. But guess what? He went to his normal, regular physician 6 months before this. His white cell, and I said, give me that test results he had back done 6 months ago. His white cell count was a little bit elevated, which is sort of suspicious, but his doctor just told him it was probably the flu and did nothing. If he had waited until the following year, he'd be dead. We caught it in time. There is medication for that. He's in remission, has been for several years. He's doing okay now, so he's really glad that he got that checked. Thank you. Here's another example. Kidney disease is always sometimes a tough one. This is a woman, I see her this many times too. She'd known for 40 plus years, every time she went to the doctor, she was told that her kidney tests were out of range. Something's wrong with her kidneys, but we don't know. It's not bad enough. You don't need a kidney transplant. There's no medications to make your kidneys work better. There are supplements that make your kidneys work better. And for the first time in over 40 years, her kidneys improved. This test, the very last test, is a measure of stress on the heart that I talk about a lot, BNP. And that was elevated, out of range, and it dropped over 50 points. Her cholesterol dropped 30, 40 points, and she was very happy about that. So why don't all doctors do this? They're not trained. It's not part of medical school to do more comprehensive testing like this, and especially they're not trained to identify earlier signs of stress on all your organs and systems. And there's nothing wrong with that, really. Most people wait until they need medical care before they go to a doctor in the first place. Medical doctors are busy cleaning up the mess that you show up with, and you need drugs. So if you want more comprehensive testing, you're going to have to go to someone that practices functional medicine. And that's my mom's favorite picture of me. That's not when I started in practice, but I have been in practice for 35 years, and those are some conditions I treat successfully over many, many years. Does anybody have any questions? Don't hold back. Yes, in the back. The first step is I send you a 7-page questionnaire, which you fill out. So you're thinking about all the things that might need some support because everything's connected. We set up an appointment, initial consultation. It's $300 an hour for consultations, but it usually only takes a half hour, the first one. So it's usually $150. At the end of that, I'll tell you what tests are best to identify what's going on with you, and we take it from there. Typical workup with the blood work and the follow-up explanation and the plan of action is usually about $700. Right?
Thank you, Doc.
Thank you.